Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Tracy Douglas, VCHA's CEO, and your host for this episode. On CommonHealth, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. Today, I am joined by three wonderful guests. Dr. Theresa Burriss is the Assistant Vice President of Community Engagement and Economic Development at Emory Henry College. Prior to her post with Emory Henry, she was the Chair of Appalachian Studies and the Director of the Appalachian Regional and Rural Studies Center at Radford University. She holds her PhD from Union Institute and University in Appalachian Studies and Women's Studies. We also have Jane Sage, who is a family practice nurse practitioner, and she's been a nurse practitioner for 15 years now, mostly working in primary care. She has also worked in hospice and palliative care for 2 years. She currently works with Tri-Area Community Health at their Grayson location. Jane is from Wythe County, a native of an Appalachian community. And Dr. Paige Billman, who has experience as a generalist, providing therapy and assessment in primary care, community services, college counseling, and psychiatric hospital settings. She loves Appalachia and has a strong commitment to staying and working in the region. Dr. Billman completed her studies at Emory College in Kentucky and Radford University. She also works at Tri-Area Community Health at their Grayson location with Jane. And ladies, thank you for joining us today. We have had this particular show on our docket for some time. And I am a strong supporter of course, community health, but especially rural healthcare. And as here in the Commonwealth of Virginia, the Virginia Community Healthcare Association produces this podcast for the sole purpose of really bringing everyday people's voices to the airways. And I am one who believes that Appalachia is one of those areas that deserves a voice. And when we finally got you pinned down for this show, I was just absolutely excited that we're able to make this happen. So welcome, ladies. I want to say here in Virginia, and more specifically around the Richmond area, listeners, right now we've been having some pretty good weather. And I have to ask the ladies here, where I'm at, it's nice, it's seasonal and beautiful and sunny. Can you guys talk to me a little bit about what's going on over there in good old Appalachia when it comes to the weather today?
I'll jump in. Yesterday morning, we started at 60 degrees, and then by the end of the day, we were down in the 40s because of a cold front moving through, pretty intense cold front, but such as weather in the mountains in February. You just have to prepare and dress in layers.
Right. Exactly. That's exactly right. When I come, and listeners, just so that with Dr. Billman and Jane, working at Tri-Area Community Health, I want to make sure I make note that is one of our community health centers. And listeners, if you can recall, for those of you that continuously listen to our podcast, you know that we are a strong supporter of community health and community health centers, federally qualified community health centers. So to us, it just made a lot of sense for us to have Dr. Billman and Jane here to join Theresa as we talk about the folks, the beautiful folks, quite frankly, in Appalachian area. Let's start with an overview of the Appalachian culture. And Dr. Burriss, I'd really like to start with you. Can you tell us some about the Appalachian culture and communities? And before you get to that answer, can you talk to us a little bit about what your story is and what you bring to the table when it comes to us understanding about the Appalachian community?
Sure. I am an Appalachian. I was born and raised in Northeast Tennessee, Southwest Virginia. I come through it by birth and upbringing. And then as time went on, I have devoted for the past almost 30 years my life to the region in terms of making people aware of the diversity of the region. Tracy, when you ask about Appalachian culture, there's really no monolithic Appalachian culture. We talk about the plurality, even though many people think it's a homogeneous region. There is diversity within the region. And even when I say the Appalachian region, there are different definitions of Appalachia. There's the political definition, there's a geographic definition. So it's a bit of a messy, if you will, concept. And that's part of when I provide Appalachian cultural sensitivity trainings to healthcare providers, that is partly what I talk about. We have to live with this tension, I'm going to identify it as, between Appalachian identity in the singular and Appalachian identities in the plural. And a lot of that draws from feminist theory in terms of the political power of one identity, but yet the danger in essentializing an entire people. So here again, you have to live with that tension. And those are some of the things that I talk about when I'm providing the workshops.
So, Theresa, you've done some work and researched and studied the Appalachian community and culture and all that. And can you tell the listeners what brought you into studying the culture like you do? And then speak to us a little bit about what can you tell our listeners about the community as a whole?
So I was born and raised in Appalachia in Northeast Tennessee, Southwest Virginia. So am an Appalachian by birth and came to study the region not until I was in my 30s. And it was while I was at Radford University in my master's program that I first was introduced to Appalachian studies as a discipline. And since that time, I have devoted my life to serving the region in various ways. And one of the ways is by providing Appalachian cultural sensitivity training to healthcare providers and talking about the diversity that exists within the region. There is no monolithic Appalachian culture. There are cultures, plural, and even contested definitions on what Appalachia is, looking at the Appalachian Regional Commission's political definition of the region versus the geographic definition of the region, and talking about the tensions that exist between Appalachian identity in the singular versus Appalachian identities in the plural, drawing from feminist theory with the strengths of the political strength of one body, but yet the danger of essentializing with that one. So here again, living with that tension and contextualizing the region historically from a political economy perspective, multiple disciplines that inform who we are as a region.
It's interesting you say this because as I was doing some of my research to get ready to do this show, you talk about how it's not a monolithic, right? And yet at the same time, there are, in some respects, we look at some differences, right? When we're in healthcare, we have to adapt to our environment and how we bring ourselves as a provider to our patients, right? And Dr. Billman and then Jane, I'd like for you to share with us a little bit what your experience is working with your patients that are from the Appalachian community. We've been told and we've been taught that the poverty are way different or somewhat different than what you're seeing more in the urban community. You also are looking at family values, right? We have heard that many folks from the Appalachian, they value family and community, whereas in the urban setting, you're more independent, and not that they don't value family and community, but you're more independent. And then you look at some of the educational components, and we've been told that, and some of the statistics are showing that folks who live in the Appalachian community tend to not have the higher degrees, go to college, but yet in the urban settings, we see more of that. So, can you talk to us a little bit about some of those differences and how you meet your patients there at Tri-Area?
Sure, I'd love to. I was thinking about this before we started today, and Grayson County and this part of Appalachia. And I think this part of Appalachia culturally still really mirrors Lloyd Jones's writings from way back in the 70s about Appalachian values. And here I see in my patients a real love of place, the love of family and community that you're talking about, and just networks and webs of that, for good or bad. A real strong sense of religious values that comes into play a lot.
Mm-hmm.
Often people have a lovely sense of humor. Yeah, there's a personalism here it makes working with people here really nice. I like both Theresa and Jane. I'm also a native of Appalachia, so it's real comfortable for me. But in terms of interacting with patients, when you know that coming in, you don't get to have this doctor-patient relationship like you might expect other places. If you want to make a connection, you better be able to make some jokes and pick up on family names and remember them. And yeah, even love of place. I had a young patient recently, and we really built rapport by him telling me about where the beaver dams were around here and saying, do you know out on Fairwood where you go past the graveyard and it's along? And I was like, yeah. And I went and looked for it. So now I can tell him, yeah, I saw that dam. I think it helps us not to get above our raising either, because people here are very personable. Really, some of the best parts of the culture are here. Yes, there are problems getting people resources. We do have higher rates of poverty, but we also have people who are raising gardens and raising chickens and doing a lot for themselves. It's a great place to work. I think Jane would say the same thing.
Yeah, Jane, it's interesting that you say that, spoke to that, Dr. Billman, because and Jane, I'd love to hear from you and what your thoughts are. But one thing I do want to just make note of was the raising gardens and really focusing on their dietary, on how they meet their dietary needs. And I was looking at, I don't know, it was a news program maybe a week or two ago. And the program was interviewing, actually here in Virginia, a chef that's from Appalachian. And he decided, he went to New York, got himself trained, worked there for a long time, Michelin star, that kind of thing, and actually moved back to Virginia, back to his community. Because a lot of what you guys shared is a lot of what he said, but he wanted to bring that sense of relying on yourself and your environment with regards to the food. And he took the newscaster to the creek in the back of where his restaurant was, and he pulled some of the greens from the back, and lo and behold, a lot of what he was pulling from the creek was going into the salads that he was preparing. And so I say that to really support a lot of what you said, Dr. Billman. And Jane, when you talk to your patients about their health care and meeting their health care needs, I'm sure nutrition plays a big part in that. And knowing how people feel, Appalachians feel, right, about their connection to their land. How is that? What is conversation like?
So, culturally speaking, Lots of folks around here, and I could speak about my grandmother. She fed you for everything, whether it was a celebration, whether it was a tragedy, whether it was you had a terrible day, whatever the occasion, she fed you. And that's a lot of what I see around here. People are attached to their biscuits and gravy. And if I tell them you can't have biscuits and gravy, they're probably going to stand up and walk out. So we have to find common ground. And instead of having biscuits and gravy 7 days a week, let's do it 2 days a week. And lots of folks do grow gardens. There's lots of self-sufficiency, which is phenomenal. And people love to bring in the things that they've canned and they share with us, and they bring the vegetables they've grown in their garden and share. And it's wonderful. There's a wonderful sense of community and even family. They consider us part of their family.
The three of you women are doing great things in the communities that you come from. But how can someone who's from a different community, healthcare provider, such as you, Jane, and Dr. Billman, and we need healthcare providers. We need more healthcare providers in Appalachia. And how do we help those newer providers that aren't from that community meet these individuals where they are, knowing that their perspective is so very different from where these other providers are coming from?
That's a lot of why I've been called in by different FQHCs, and I've even conducted these workshops for pulmonologists at UVA. I've done workshops at the VA hospital in Salem, because people recognize, and this is true no matter where you are, cultures exist wherever you go. And it's up to healthcare providers, and I'm going to say any discipline, to truly be effective where you are. You need to understand the cultures that exist there, and also recognize, Tracy, as you alluded to, that we each come to a situation with a certain paradigm because of our own cultural background, and we need to be self-aware in those interactions, no matter whether it's here in the States or abroad. And I think that what I tell participants in these workshops is, you're getting a day-long immersion into Appalachia. I teach multiple classes over 14-week semesters about all of this. So this is only a high-level overview. So be aware of that, but it at least gets them thinking about some of the cultural characteristics. And I do, Paige, I love that you brought up loyal, because I do incorporate his Appalachian values piece, which, even though we are a living, evolving cultures responding to national and even international events, there are still some enduring values that exist. And that's not to say that we have to be careful about the rose-colored glasses perspective, because, as Paige also said, we have real problems. But this is where it's also important to understand the systemic inequities that have plagued our region, whether it's mono economies, whether it was greed-fueled pharmaceutical companies, whether it was attorneys and folks at other healthcare facilities lying about black lung issues. We need to look at, I'm very much a strengths-based approach person, but we also have to acknowledge the challenges and then, here again, contextualize those.
Yeah, we have a community health center here in Virginia that sees a lot of black lung patients. And at the end of the day, it's like James said when we're talking about their diet, right? These folks are to me, they're beautiful people in that they just look at where they are in their life as surviving. These are the things that we do that help us to survive, but are not going to look at them in a way that draws negativity, right? And so with Black Lung, and Theresa, you referred to this, these are people that just look, this is their job. This is what they do to survive and take care of themselves and family. And Dr. Billman, when we see patients like that, when we know that the decisions that they've made in their life is causing something that could harm them health-wise, as a provider, how do you help them through that? Because as a provider, we are under a lot of pressure to meet certain metrics too, right? We want our community know that we care about them, and we care about them in a way that we're going to focus on quality. We're going to focus on helping you be healthy, stay healthy, get healthy. So how do you address that?
Yeah, that's an interesting question, and I think ties back to the last one too. But your example there was these people who have Black lung are working in the mines, and that's their survival. That's not something that we can really get them out of necessarily, right? It depends on the situation. Here, there is a Christmas tree farming industry is a big industry in Grayson County, and there's a lot of concern about the spraying of the chemicals that goes on here. But people can't necessarily move, and even if they could, they wouldn't want to. I think what Theresa was saying too, we have to look at it in a systemic way as well. And so I guess I'm speaking to both of your questions. When providers do come into the region from elsewhere, it's really important that they don't just believe what they see in the media about Appalachian people. And if they do see some of those traits, this person's stubborn, they don't want to do what I'm telling, then ask why. Why might they not want to take your word for it? Right? Because we aren't really used to people coming in here to actually help us out. That's just what they say they're going to do. So, yeah, I take that approach when I'm working with people and saying, okay, let's talk about smoking. It's the same thing. A lot of people here, their families were tobacco farmers. There's not as much of it now, but a lot of people grew up that way and or used to have tobacco allotments themselves. And so it's also culturally relevant. So we want to look at why are they smoking? What does it do for them? And what could they do to meet those needs otherwise? And yeah, to me, it's you're working with them, understanding where they're coming from instead of having a top-down approach, because that is never going to work here.
Yes, I applaud for that. And one of the things that in my job, in my role, and part of why we're doing what we're doing with this podcast is to help individuals understand that we are all unique in our own way. And a lot of the reasons why is because of where we come from and how we were raised. And every part of that is so unique and special, right? And so at the end of the day, I want to go with something you said, Dr. Billman, when you said, many people that you see in the clinic look at it as, well, they don't want to help us anyway. They say they're going to come in and they're going to do this, but yet it's really not going to make much of a difference. And Jane, you and Dr. Billman and Theresa all have gotten yourself educated to a point where you can make a difference with somebody. How do you get to them? How do you get at that kind of mentality of, are you really going to help us? Are you really going to be able to step up and do what you need to do to help me get to where I need to be?
That is a great question. First of all, leave your pretension at the door. And I love what Paige said about we can't take a top-down approach. I do see lots of people that are here because my wife made me come. My mama made me come. I don't want to be here. And so I just sit and take the time and say, well, why does your wife want you to come? Why does your mom want you to come? What are your thoughts about that? How is this affecting you? And my philosophy is I meet the patient where they are. And I tell them frequently, I say, you're the captain of this ship. I'm merely here to help you navigate the storms as they come.
And one of the things that we're seeing, and the statistics are showing this, as well as why many of our government, our state and our local, as well as our federal government, has put some attention to this. And I want to, although we're still talking about this community, the Appalachian community, this beautiful community, I do want to hit on something that's been a national epidemic. And we have seen it more in this community in the rural parts of Virginia, as well as in other rural parts of the country. But the opioid epidemic, right? How did it become such an issue in the Appalachian community? What happened? Theresa, I don't.
Because we were targeted. Purdue Pharma targeted us along with rural northern Maine. And there's all kinds of literature out there and news stories about how the representatives of Purdue Pharma lied about the addictiveness of the drug. We had Dr. Van Zee in Lee County, Virginia, the westernmost county of Virginia, sounding the alarm, calling them out, saying, this is not what you were describing in the 90s. It did not become a national epidemic until it left the borders of Appalachia. Before that, we were referred to as pillbillies. It was a blaming the victim. And here again, it was all driven by greed. If you look at the profit that Purdue Pharma, and I'm just focusing on Purdue, there are other culprits. And there are culprits in the medical community. There are doctors, physicians who have gone to jail or prison because of abusing their prescription privileges because they were getting kickbacks. But here again, if you look at the profit jump over a short period of time with Purdue Pharma, it is astronomical. And now look at what is happening with the Sackler family and all the legal. This is why we have the Opioid Abatement Authority giving out money.
Right.
Because of retribution or whatever, restitution.
So then, Dr. Billman, from a mental health perspective, if it has infected this community, how do we help them? How do we, as a community, as a society, how do we help this community, especially if they have an opinion or an impression about folks coming in and not really wanting to help them? They say they do, but they're really not going to.
Those are great questions. I tend to work on a more one-to-one basis. So there's that. But I think there has been a lot of change with the opioid epidemic. We have made a lot of improvements. And I think through things like community health care, we've made a lot of improvements. There are other problems now, but it's getting better. I think through education, through the media that's come out about the epidemic. And like Dr. Burriss was saying, Purdue Pharma and the way that it happened, I think that's helped. Barbara Kingsolver's beautiful novel, Demon Copperhead, if for anybody who hasn't read it, beautiful depiction of Appalachia, nailed the epidemic and just gave a really good personalized opinion of that picture of what that looked like for one person. But yeah, I think it's through education like that, and it's through meeting people where they're at and understanding the reasons behind it, and letting them have care where they're not totally stigmatized, and we're not just finding another way to make money off of people by putting them in the methadone clinic and leaving them there, making sure that they have therapy resources and enough providers down here, which is something we're always trying to do, is keep behavioral health physicians filled, and it's hard to do. It's hard to draw people to the region to work here. But when we can do that and they're getting the actual care they need instead of just bottom of the barrel, just enough to keep you alive kind of stuff, then you see real change. Because a lot of people who have opioid problems here got into it many different reasons. But there are people like anybody else who just want to have a good life and they get stuck. And so respectful treatment really helps.
I love that. Respectful treatment. That is a beautiful way of saying what the work that you're doing at Tri-Area and many other community health centers in the Commonwealth of Virginia, as well as throughout this country. I absolutely love that term. Love that term. One of the things that we struggle with, and Dr. Billman, you talked about this, was the idea of attracting providers into this community and into rural America. And we struggle with this. One, we're in a crisis point now as far as being able to, we're getting to a very finite number of primary care providers and mental health providers, unfortunately. And that being said, many of our providers are getting to a point where they're burned out and they just want to leave the profession entirely. So then that leaves a huge void in the Appalachian community. Jane, how do we appeal to some of these newer providers to get them interested and wanting to take an interest in coming into the Appalachian community?
Oh gosh, lots of people will come to this area for simply no other reason than they can get their student loans paid back to a certain extent, which is very attractive when you come out of school with huge student loan debt. And then it's always my wish and my hope that they will fall in love with the area and with the people here and with the beauty of the area, because it's beautiful, and then they will stay. If they will get a good dose of these people in this area, lots of times they will just love it and stay.
And I think the other piece that we can say is you have people like yourself and Dr. Billman. Once they walk through the doors of a community health center, they can see and feel not just the expertise that exists in our community health center, but the love and the sense of team and camaraderie that exists in a community health center. And before we close for the day, Jane and Paige and Theresa, if you could just real briefly speak to some of the work that you guys are doing at Tri-Area Community Health. I think it's important that we remind not just our listeners outside of the Appalachian community, but can you just share for those who are in the community that we might not have had a chance to touch yet? But I'm convinced after this show we will. Can you just talk about some of the services that you all are providing there? What makes you all stand out? Dr. Billman, we'll start with you first.
We have behavioral health providers in all of our clinics at this point. We have clinics. We have another clinic that we recently opened on the other end of Grayson County in the community of Freeze, the little river town. We're providing behavioral health out there. That clinic has a full pharmacy. We have pharmacy services. We have three. We have 3 full pharmacies, and the other clinics get delivery services for their medications to all the clinics, so people can get their medications really easily. We just started a satellite site out in another part of Grayson County to provide services out there. We have primary care at all of our clinics, obviously. We have Suboxone treatment in some of our clinics. We have psych testing in our clinics. We have a really wide range of services for people. Yeah. And our CEO, Jim Worth, is always expanding those services. He's very dedicated to the region himself and is always working to make more and more available to more people out here. So.
Yeah. Yes, Theresa, please.
I was just going to say that, Tracy, when you were talking about how do we recruit people to be healthcare professionals, there's another avenue of grow your own. And Emory Henry is involved in a lab school called the acronym is HEALS, and it's sponsored by the state. And it's a collaboration between Emory Henry, the Southwest Virginia Higher Education Center, the counties of Wythe, Smith, Washington, and City of Bristol, working with high school students who are interested in a healthcare profession to channel them, and also the community colleges in Wytheville Community College and Virginia Highlands Community College, all working together to provide opportunities and to show what's possible to our own students, our young students, so that we are growing our own. which is another way to address the shortages.
Yeah. Look at Dr. Billman and Jane, right? That to me is for them to want to come back to their community and provide the care that they're providing. They could have gone anywhere. Again, we're in a crisis mode, but these two women we're going to go back into our community. And for that, I cannot thank you enough for bringing your time, energy, and talent back to your community. So listeners, I really hope that we were able to pique your interest. I think there's great stories to be told and experienced in the Appalachian community here in the Commonwealth of Virginia. I really hope that you will take the time to come and visit us. Come and visit Tri-Area. For those of you who are in those communities now where Tri-Area is located, they've got multiple communities, but they are there to make sure that they're servicing and ensuring that they're meeting your needs and where you are with regards to your health. So with that, ladies, Dr. Burriss, Dr. Billman, and Jane, I thank you for your time. I want to thank my guests for joining me today. And thank you to all the listeners for tuning in to CommonHealth, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support CommonHealth, I encourage you to hit subscribe button and share it with others on social media. Leave a rating and review or visit our website at www.vcha.org. This is Tracy Douglas Wheeler, and thank you again, and I'll see you next time.